Hello and welcome to the Ideal Nutrition Podcast. My name is Aidan Muir and I'm here with my co-host Torwen Eerkens, and this is episode 261 where we're going to be talking about common foods linked with bloating and gut issues. As a bit of background, we're probably more specifically just talking about what I'd say is like more general bloating and gut issues. So we're not speaking about very specific gastrointestinal conditions. Like this won't be covering celiac disease or inflammatory bowel disease or anything like that. Obviously, we strongly encourage ruling those things out first in many cases, but we'll be talking about more general stuff.
For sure. Bloating is probably one of the most common complaints we hear about gastrointestinal-wise in the clinic. So what it is, it's the feeling of fullness or pressure in the abdomen, often caused by a gas buildup, poor abdominal emptying, increased sensitivity, or abdominal volume. And it can come with discomfort. So before we talk about food triggers, it is worth flagging that for some people, chronic bloating is more than just gut issues. And diet choices, it can actually be an underlying sign of a gastro condition like Aidan just mentioned. So if you are experiencing bloating, it's important that you rule out conditions like celiac disease, IBD. And if it's persistent, severe, or it's worsening in symptoms, please do go chat to your doctor before trying to self-manage.
So going through foods and food components individually, the first one we're going to start off with, and this is in no particular order, is lactose. And roughly 65 to 70% of the world's population has some degree of lactose malabsorption after childhood. I really like that stat because I feel like if you just asked a bunch of people, you're not going to get 65 to 70% of people reporting lactose intolerance, but that's a really high percentage of people that have some degree of this. That figure is obviously skewed by population groups. So for example, in East Asian populations, it's as high as 90 to 95%, whereas in people of Northern European descent, it's closer to 5 to 15%. One reason why I care about identifying lactose intolerance or even lactose malabsorption specifically is that there's a lot of people who feel like they don't do well with dairy, who could be completely fine with dairy from other angles, and it's specifically just lactose that's the issue. There's many ways you can go about testing this. I think the simplest one is testing lactose-free milk, seeing if you get symptoms, testing regular milk, seeing if you get symptoms, having enough of it to cause symptoms, repeating the test if you're unsure. That's more accurate than even, like previously people would use like breath testing as a method, but I would say even what I just said there is more accurate.
For sure. A bit of science behind why lactose can cause bloating is because when it isn't digested properly, so people who lack the enzyme to break down the lactose, it reaches the large intestine, which means gut bacteria can ferment it. It produces gas, which then causes the bloating, cramping, and potentially also sometimes diarrhea. Doing a test like Aidan mentioned is great because it's worth noting that lactose intolerance also exists on a bit of a spectrum. So lots of people will be able to tolerate small amounts of things like milk in a coffee, hard cheeses, which are naturally quite low in lactose, or fermented dairy without many symptoms. Full elimination isn't always necessary.
And something that I'm surprisingly passionate about is the whole concept of people being able to tolerate small amounts of it. Like for example, if a hard cheese has 0.1 gram of lactose, a number I use is that almost every single person with lactose intolerance can tolerate about 3 grams in a single sitting without symptoms. That's a number I'm very comfortable with. There's even a paper out there that dietitians always send to me whenever I post content on lactose intolerance, so that people can tolerate 12 grams, which is the equivalent of 1 cup of milk. And I'm like, well, I don't think most people who self-identify as having lactose intolerance are not going to get symptoms from a cup of milk, but there's more going on here. But the reason why I'm so passionate about those really low amounts, like 0.1 grams being clearly not going to be an issue, is that mechanism. Like if it's just going through undigested, causing fermentation, so on and so forth, 0.1 grams can only ferment so much. Larger amounts can ferment far more, right? But it's not like, say, celiac disease where your body's like attacking itself. It's just going through undigested and this fermentation process occurs. So if somebody was getting symptoms from a super, super, super low amount of lactose, I would be speculating that there's other things causing those symptoms.
For sure. Our next one on the list was bit more of a general gastro triggers. So some foods can irritate the gut, especially if there is a bit of inflammation in the stomach lining. So they may be worth exploring, especially if you're experiencing a bit more of an upper stomach bloat or bloating quite soon after eating. Foods include fatty foods, which slow gastric emptying, meaning that the food sits in your stomach longer, which can lead to that fullness, reflux, bloating. Spicy foods can irritate the gut lining. Carbonated drinks actually introduce gas directly into the digestive tract, which is quite simple, but can be overlooked if you're someone who consumes them quite frequently. And then alcohol and caffeine are two others to be mindful of as well.
And that's like what is often like frontline, like general bloating and IBS type management stuff. And one thing I found interesting is I heard so many people say stuff like that. And then after reading all this research on FODMAPs and other things that we're going to talk about later, I saw a study that just like put together a large group of people and told them to like avoid these foods. And it was a massive improvement in symptoms as well, almost to the same degree as some far more complicated approaches as well. That said, in many cases, people will have difficulties with like, I'm just not going to drink forever, or I'm not going to have caffeine forever, or whatever. There's other challenges that come alongside this as well. Another one we're going to talk about is sugar alcohols. So we often will find these in things like protein bars, chewing gum, sugar-free lollies, a lot of low-carb, sweet alternative products in general. Even within this category, there are different sections I'd be aware of. So maltitol, sorbitol, and mannitol are common triggers of bloating, whereas two other ones, which are xylitol and erythritol, are less likely to be issues. And once again, this is due to how much is needed to make things sweet and also how fermentable they are as well.
For sure. Same with it before. It is a sugar alcohol, and if it doesn't get absorbed, it gets fermented by gut bacteria, which then produces the gas, and in large quantities that causes bloating and pain. So if you are eating a lot of diet products or low sugar products and you're experiencing bloating as a gut symptom, this might be one that would be worth investigating. Gluten and wheat. Now this often gets a lot of attention, and yes, for good reason. But it can be a bit misunderstood. So very important to separate the celiac disease from the non-celiac gluten sensitivity. Of course, celiac disease, even tiny amounts of gluten can trigger an immune-mediated response. We're not talking about that today. We're talking more about general bloating symptoms. So for people without celiac disease, symptoms can occur with gluten ingestion, but interestingly, a lot of research actually suggests that it's more the fructan component, which is a FODMAP, of the wheat, which might be a driver of these symptoms. So if this is something that you're wanting to trial, a really easy swap is just trying to swap to spelt-based alternatives. And if you're okay with that, then it's more likely the fructan than the gluten in the food.
Garlic and onion is another common trigger here. I don't have too much to say on it beyond it's just another really common one. Like if we went through a group of people who have heaps of bloating and symptoms like that, garlic and onion are common triggers. It's tricky because they are prebiotic rich foods, so they're so great for health overall, even for other reasons too, but they can be a common trigger. A lot of people can still have them in smaller amounts without it being a trigger. There's often a threshold as well, but it's another one to look out for as well. I've also come across a lot of people who only get symptoms when they eat out, and it's because they don't add flavour when they're cooking at home. And that's part of why.
I was going to say, the tricky part with onion and garlic is that it honestly is everywhere, often when you eat out, and it can be quite hidden. So exactly what Aidan said, if you're eating out and you're noticing symptoms, consider, is this what's going on? The other thing is, same with like having a portion that you might be able to tolerate, do some trials, because it'd be, if you know that you can tolerate maybe a quarter of an onion compared to more than that, it just means that you're not avoiding foods that are great for gut health for no reason.
Other FODMAPs, so one we'll go on is oligosaccharides, or the simplest way I'd look at this is legumes is a big trigger for a lot of people as well, particularly if not used to having them in your diet, particularly if there's a quick increase, but also they can be a trigger for people regardless. One little hack that can help a little bit is rinsing them, and also cooking them well is another thing that can help too.
Mannitol then, found in sweet potatoes, mushroom, cauliflower, that sort of thing, that can be an issue for some people too.
Then generally high/rapidly increased fiber diets. The far more common one is like a quick increase in fiber. That can cause issues as well. It's something that you want to start relatively low and then go slow with your increases. That can often allow your body time to adapt and can kind of offset this. But then the other area is that it's far rarer, but if people just have a really, really high intake of fiber across the board, this could also be a thing. One thing that makes this tricky to interpret though is most people who have a really, really high fiber intake also have a high intake of other triggers in here as well, usually other FODMAP stuff alongside other like food chemicals and things too.
For sure. Meal size is probably another one that's just important to consider, because larger meals do stretch your stomach. They will slow the gastric emptying. They increase that volume of food that needs to move through the digestive tract at one time. And this can cause bloating, fullness, discomfort. So important to think about, if you're getting bloated after super large meals, just split up your meals into some smaller meals across the day.
And then we've got another kind of category where we've put a bunch of stuff in here, like food chemicals, histamines, and then CSID in here as well. So with food chemicals, I'll just start with that one. So we've got salicylates, amines, and glutamates, plus some food additives as well. These can be triggers too. Even like salicylates, a lot of those are found in just like plant-based foods. So like that's another thing that overlaps a fair bit with FODMAPs as well. For
sure. And with histamines, it's foods that either are high histamines themselves, the histamine liberators, which cause your body to release more histamines, or DAO inhibitors, which can prevent the DAO enzyme from breaking down histamines. I had two more things on that list in our other category. And that includes delayed transit or gastroparesis. That can be a cause of bloating for some people. That is something that you most likely will chat to GP and then gastroenterologist about. And then constipation, just making sure that you keep your bowels moving, because if you think about constipation in the gut, having volume there can then cause bloating as well.
Cool. Now, practical. So we've got a few things that you could start with. One is a food and symptom diary. I love this recommendation. One caveat I have is I don't think it's as perfect as sometimes people would make it think or make it seem. Specifically, some of these things that can cause issues as much as 24 hours later. So wheat is a great example of that. Lactose is much quicker. Like a food and symptom diary works perfectly. You have lactose an hour later, or maybe even slightly less, you have symptoms. Wheat, you will never pick up on a food and symptom diary, because if you have wheat every day and you have symptoms every day, you can't connect it really that easily.
The big thing with a food and symptom diary, I say, if you're bringing it to a professional, make sure you're quite specific with timing, and for that exact reason, because it can be so hard to pick patterns if there's no time of symptoms and you're just putting all your symptoms in there quite randomly. And also noting things like your meal size, stress levels, and anything else that you think might be relevant. Our other practical recommendation was making sure that you do get testing where appropriate. I think that makes a lot of sense. So we said before celiac disease, and then whether or not you do any other tests, stool samples, that sort of thing. In terms of food sensitivities tests that are sold commercially, this is something that we don't recommend. They often lead to unnecessarily overly restrictive diets, and there is not much research supporting them.
And then the last practical recommendation is, if you're going to do elimination and reintroduction type of stuff, we recommend chatting to a dietitian. Anyone who's listened to this for a long time knows I don't plug dietitians super often, even though I'd love to. But a line that I have that even to this day, I've been a dietitian for 10 years almost, I've never had any exceptions to this so far. I'm sure it exists. I've never seen somebody do a low FODMAP diet well by themselves. And that's crazy, because I've seen so many people do so many things well by themselves. I've seen so many people do weight loss well by themselves. I've seen so many people manage diabetes well by themselves, and like so on and so forth. But I haven't seen that with the low FODMAP diet, or any of these other like elimination diets as well. Sure, it exists. I just haven't seen it. And that, even if it is out there, which I'm sure it is, it just means statistically it's probably a lot more likely to go well with a dietitian. So encouraging that as well.
100%. I've never seen anyone that has done that. Yeah, exactly in the same boat as you. So the last little thing I had on there that might help are just considering any others. So that could be things like probiotics or things like antispasmodics. So specifically, peppermint oil is a muscle relaxant, and this helps to relax, which it allows trapped gas to pass through, which can help reduce IBS-style symptoms. So dose for that is 0.2 ml to 0.4 mils of peppermint oil 3 times a day, 30 to 60 minutes before eating. It's worth knowing about a few other strategies before going completely restrictive with your diet. We will wrap up here then. This has been episode 261 of the Ideal Nutrition Podcast. As always, if you enjoyed this episode, we would love if you could leave a positive review. Thank you.